Welcome to the Let's Keep It Light podcast, and thanks for listening. In this episode, Ginger and Marcie will discuss addressing acute and chronic pain with light therapy.
All right, well, our topic today is pain, and there's a couple of main categories of pain: chronic pain and acute pain. And when we're dealing with photobiomodulation or light therapy, we oftentimes think, well, we'll just do it the same, but we don't necessarily use the products the same for chronic versus acute. Is that accurate, Marce?
Very, very accurate. The importance of knowing the difference is huge because you can decide to use light therapy on pain and you claim it doesn't work. Well, it was the procedure that you were using that didn't take advantage of the technology. So that's why we want to go over the differences and how to apply them in situations that are acute and in situations that are chronic.
So I know when we first started using the light therapy system, and again, it was the pad-based system. Okay, we were just told, because we were all learning, we'll just put it where it hurts. And usually that would work until you, Marcie Denton, started teaching the light therapy courses. And we were learning from you that, well, why doesn't it work every time if the solution is just put it where it hurts, putting the pads where it hurts? And you really cleared that up for us. So I thank you for that. And that's what today's episode's about.
Right. What would you like to start with, Ginger?
Well, let's just define acute versus chronic.
Okay. Acute pain is pain you know when it happened, how it happened, where it happened, and it's unpleasant right away.
Such as you sprained your ankle.
Or you missed the nail and hit your thumb. I mean, it's very real, very happening. You don't have any problem remembering that you hurt yourself.
Oh, when I tripped over the pickleball net and gouged my leg and bruised myself. That's acute or ugly pain, but
yeah,
acute, A-C-U-T-E.
It is not cute. It's acute.
It definitely was not cute.
Okay. Now, chronic pain is, by the way, most of what shows up in our clinics and in our practice. This is pain that you can't really tell when it started. You don't know how it started. You just know you've had it for a long time. And it will not go away. And you've tried A, you've tried B, you've tried C, and now you're trying light to see if that will make a difference. It will if we do it in such a way that we are addressing the nature of this pain and how it is changing the body. So we can get into that in detail in just a little bit.
Okay, so would you say, though, for acute pain, it's pretty accurate? Put the light or the pad, the torch or whatever, just generally where it hurts.
There's a couple of rules that I have in my experience. It will relieve pain because it is enhancing the use by the body of oxygen. And we go back to what that really is in photobiomodulation, is you put the red light, infrared light, and the body can then begin to use oxygen like it should to burn up food so that it can have energy to do work, and the inflammation goes away and the pain goes away. And bingo, that's acute pain. That's, you put it on where it hurts, and that will happen most of the time.
So I know when we have someone come into our clinic for body contouring and we're putting the pads on and also the red infrared bars, and we're putting it maybe nowhere near their big toe that hurts because they didn't tell us the big toe hurts or the ankle hurts. But over and over again, people will get off the table and say, wow, well, this part of my body was hurting. You didn't put the lights there, but it doesn't hurt anymore.
Exactly. So the systemic release of inflammation is what's going on. So once you are applying light to one area, you are affecting the circulatory system, and the circulatory system goes everywhere. And so the reduction of inflammation that we're known for, photobiomodulation is, then it is systemic. It starts where it hurts, but it does actually influence the entire body.
So it's common for us, at least the first decade of me using the pad-based system, we would pretty much, like in a demo at a trade show or at a seminar, put the one pad over the navel, another pad so the front of the body, and that's going to cover the liver, gallbladder area, the stomach, the navel, the all the organs in the midsection of the body. Would also put one mid back, so that's going to cover, get those kidneys and the adrenals and all that, and the lower back or mid back, all satisfied that it's being filled with light, and then putting the face mask, which really just covers the eyes, the sinus, and is part of the frontal lobe of the brain. And all kinds of great things were happening with that. When Marcie Denton came along at some point, when you came into the picture and kind of cleared up for us that that's wonderful and that's a great trade show or demo position to do it, but there's more to it, and we could have better results if we did some things like make sure to get that person to switch into the parasympathetic nervous system. And
I wondered
like
if you were going to go there.
I just went there. Okay. So why don't you speak to about
okay.
that?
I didn't go in my explanation, but there are two ways to be. You can either be stressed or you can be relaxed. Now, that's common for every single person, and you can do that in any minute of the day. You can switch back and forth between being stressed
or in the sympathetic nervous system.
Well, I'm not going to go
flight.
there just yet.
Okay.
So if you'll hold on just a second.
I'm holding on.
Okay. So this is a common situation. If someone is coming into a clinic to receive light therapy, they are not in a relaxed state.
Usually that is the case.
They cannot be in a relaxed state, in pain. So one of the things that we teach is this naming the state of stress, which is sympathetic, and the state of peace or relaxation, which is parasympathetic. The way I remember it as a dyslexic is that parasympathetic means peace with a P, and sympathetic means stress with an S. So in order for the body to use systemically the light that we put on it, it needs to be in a parasympathetic state.
Relaxed, sleeping, and meditating.
Right.
That's where the body heals, is when we're in the parasympathetic nervous system.
When someone comes in and is in pain, they are not relaxed. And that state of relaxation we call parasympathetic. They are in a stress state, which we call sympathetic. And so our goal is to move them in the early stages of the therapy session into a state of relaxation, into a state of parasympathetic. When that occurs, then applying light anywhere in the body can be effective all over the body. And therefore, the big toe will get better.
And so one of the corrections that you put in with us and with our students was that a very easy way to get a person to shift into the parasympathetic system, even though I thought people were pretty much always going there as soon as you put light on. And maybe that was true. It was true in my experience. But after you put in this clarification or distinction of putting a pad or the lights, however they're applying lights, at the jaw, at the TMJ area, you want to explain that whole thinking there?
The major control of peaceful, calm, relaxation is the vagus nerve, and it runs under the jaw. So if we put light on the jaw or just under the jaw, we are stimulating the control mechanism for relaxation. And it doesn't take long. It's very quick. It's not magic. It's simply addressing the body's regular system of staying in a sympathetic state is not good. So you want to remove that stress for them so they can get the benefits of light to the maximum.
So in our clinic, where most often people are coming in for body contouring and weight loss and pain reduction, we now, with every client, will put a pad from ear to ear under the jaw, and then we may or may not put one over the eyes, depends on the client if they actually like that. And then we also will put one on the chest, because mostly people are not coming in to have, any fat reduction on their chest. Okay. But putting that pad there, the heart's right there, all of that together, even though the pad on the chest isn't one of the points that should, scientifically make a person shift into the parasympathetic system, there does seem to be something about all of that will shift the person very quickly. But I imagine it would happen even if we only did the one on the jaw. And also because people will commonly say, well, that they know they hold so much stress, or have TMJ, or so it's also relaxing that system, but it is shifting them.
One other location that is good for moving yourself or your clients into parasympathetic and relaxation is behind the head. It is the outflow of the nerves that are in controlling the parasympathetic come out of the back on our spine, come out of the back of the head and at the sacrum. So
the cervical vertebra or the occiput or whatever on the
between the occiput and the cervical, yes.
Okay.
So yes, there are a number of ways to do this, and once people know what they like and what works for them, then you just go with it. You don't have to do every single location.
Just whatever's going to shift them.
Right.
Okay. So this is all about putting the person into the parasympathetic nervous system, whether their pain is chronic or acute.
Correct.
Okay. But now there's a distinction with chronic pain and this is where we would find out after working with the lights for many years, that every once in a while you'd have a person that just wasn't relieving their pain for long enough. It may be for a few hours that they were out of pain, but it would come back. And so you cleared this up for us because there is a way we want to work with the lights different for chronic pain. So could you explain that and where you would put the lights differently than for acute pain, where we're just going to pretty much put them into the parasympathetic nervous system, get them all relaxed, and then put the pads where it hurts, that sprained ankle or wrist or whatever. Let's talk about chronic pain.
Chronic pain is so common. It's probably more common than acute pain. And when someone walks into a clinic wanting light therapy to get rid of pain, 9 times out of 10, it's because they've had this pain forever.
Right.
They don't know where it came from. They don't know when it started. They just know that it won't go away. They can't get rid of it. So chronic pain is one of the most debilitating issues that people deal with. Chronic pain can be better using light therapy if we do a couple of different things that we are now aware are very effective. One is, just like acute pain, you're going to want to put the light on where it hurts. But before you know where it hurts particularly, we want to know where that nerve that is hurting shows up in the spine.
Wait a minute. So are you saying that the pain is because of a nerve?
Absolutely. And that travels, the information goes to the brain, so the brain tells you you're hurting. So how does it get there? Well, it travels from this ankle or this wrist that has hurt for 5 years almost. That information goes from the hand through the arm to the spine and then up to the brain, and the brain says, ouch.
Really?
So what we have learned is that pain that is chronic involves the brain. It's a neurological issue, meaning it's part of a brain syndrome. And if we don't address that, we sometimes miss making a difference in the effect of the injury on someone, and they don't get relief from light therapy as much as they could. So how do we help them? Yes, we put light where it hurts, but we also want to put light where that nerve joins the spine, because there is a relay system in the spine. And the information, the pain information, is transferred to this, I'd call it, the gateway. And this goes to the brain from this wrist or ankle or whatever. And then we understand that we hurt. The brain is telling us we hurt. Well, how do we stop it? We do what we would normally do for acute pain. We put the light on where it hurts. But we also want to put the light on the place in the spine where the nerve is carrying the message of the injury to the spine. And then we put it right there where it joins the spine, because we want to interfere with the message to the brain that tells us we hurt.
Well, how do we know where that nerve joins the spine?
There is a lovely picture that most of us will share with you as therapists, or you can look up, and it's called the dermatome. And it is a map of all the nerves that travel from toe to the spine, from elbow to the spine, every single place that it would join up. If you were to have an injury on your elbow, you would put the pads or the light on that elbow, but you would put it not where it joins for the ankle. You put it where it joins the spine for that elbow.
So for people who have maybe a lot of pads that could cover the entire spine, but they might not know where that dermatome, they might not have a picture of the dermatomes or know where that nerve joins the spine, could they just light up the entire spine and then work on that elbow?
That would probably do a very good job. Yes. It's nice if you know exactly, because you can focus more energy to that location, but it doesn't matter if you want to just put the spine, light up the whole spine. That's not a bad idea at all.
But if you were one that was just working with the torches, where you have to know on some of the devices like a torch, so that you could focus on that part of the spine.
Correct. The nice thing about this is that when we talk about the value of light therapy or photobiomodulation, people want to know, well, is it really not magic? Is it really something science? And you can say absolutely, because the research shows that this light on the spine is doing what medications can do. For example, opiates will block the message of pain to the brain. But we can use light to do the same thing. And that is so much better for the individual, so much better for society. It's a huge breakthrough in adjusting life's negativity with opiates. If we have to have them, we have to have that medication. But if we can do with light what that medication does, all the better, and in fact, all the glory of it.
That's a miracle. So with acute pain, it can seem like it's a chronic pain because it can last up to, what, about 3 months?
If the pain lasts more than 2 to 3 months, it's chronic. It's labeled chronic. That's an awful long time for us to call it acute pain. I think of it, in my experience, if people cannot seem to resolve it in 8 weeks, that we're now dealing with the more complex issue where we have to address the dermatome, address the spine, address the issue of the pain in the brain or the inflammation in the brain.
Okay.
Another thought that I have on acute pain is the fact that if this is something that has just happened and you're beginning to put light on the injury, and if we're going to ask you to do a number on how much pain it is and you say it's a 9, well, we know you're in big hurt. So you put light on, and sure enough, after a few minutes, after 30 minutes or so, it's reduced down to its 8, you say. It's not much reduced, but it is reduced. So you begin to rest, and all of a sudden it starts increasing in pain. You have to start back with the light. The rule I have come up with is that you never let the pain go back to as high as it was. So let's just say you do that and you reduce the pain to 6. So now you're resting and you're elevating and you're doing all that the health people tell you to do, and you're just feeling so much better, and all of a sudden it starts going back up. The pain starts increasing. Add light. Call it the pain ladder. You want to go down the pain ladder. You don't want to go up the pain ladder. So that is a very, very beneficial thing to do. Now, what if that takes you 6 hours to get to a level of pain that you're comfortable with, that's stable? That's maybe takes you that long, and that's okay. You can repeat light over and over and over again to maintain this downward reduction in the pain that you're feeling.
And so, unlike opioids, you're not going to OD on light?
No.
No issue with ODing on light?
No, but one more thing is that when you get to a stable level of pain, you can reduce the amount of light that you're using. It's like a 911 event that may take you 6 or 7 hours to get to a stable place in that pain issue. And then after that, you can be comfortable with other types of pain medication that you're using, ice, etc. So it really is getting you to a point of stabilization.
And that point may happen after one session for some people.
Maybe.
It could be. It certainly has for me. If I'm in pain and I use the pads or the bars, it's very common for me or my clients that, wow, I don't, I don't hurt right now, and that may last a day, a week, or forever for that particular type of pain, or I may need to repeat it. So I think it's just a great rule of thumb that you taught us, which is don't let the pain get back to the same level that it was when you started the therapy.
That's exactly right.
And I like what our friend Jim told us, that one thing with light therapy is, unlike opioids, there's no chance that if you did continue to do a lot, you're not going to wake up dead from it.
That is true as well.
Marcie Denton and Dr. Ginger Bowler are certified light therapy instructors and co-founders of the Light and Energy Training Seminar Certification Program. You can send us an email with your questions and comments to podcast@letskeepitlight.com, and be sure to visit us on Facebook and Instagram. This episode was engineered and mixed by Dr. Decibel Productions. I'm Sarah Weston. Thanks for listening, and we'll see you on the next episode of Let's Keep It Light.